My name's Matt. I'm 43 years old. I've been suffering with cluster headaches, suicide headaches, whatever you want to call them. The beast. How can you explain it unless you have to deal with it? No one will ever understand, just us. Well, anyway, like I say, I've had them since I was 21. I'm 43 years old now. I want to show some of you out there how to split your jabs, because I've been reading some of the comments and some of you are just using whole EpiPen. I split my injections so I can get 8 injections in 2 days instead of 2 injections in a 24-hour period. You might be familiar with these. They come in a different format. I'm going to show you them in a minute, but this is how I split these. Okay, so there's the trigger mechanism. You need to pull that off. Do not push that button. We all know that's the trigger. And then you need to break the seal. Seal's broken. Okay. Now, then you need to pull it apart. It can be quite difficult. It takes a little bit of time, a little bit of a wiggle. Pull it. Okay, and then that's how that comes out, like that. Grab hold of that again. Do not push that button. Prise that apart. And that's what you're left with. £40 apparently. Now on here you've got some little stoppers either side that stop that from falling out. So you can bite them open or cut them, pair of scissors, cut one side and the other. Okay. Broken. Now this will just slide out, he says. Okay. And that's what you're left with. Some of these have some of them have more in them than others for some reason. I'm not sure why. They're sort of saying only take 2 in a 24-hour period. But what I do with this, I'm going to put this in a syringe. If you can't get hold of needles, you can just use this, and that's what I did for many years. I would get a cotton bud, I would put that in my upper thigh, and I would administer maybe half or a quarter. As soon as the attack started, as soon as I had an inkling, and it would just go. After 5 minutes it would go. And it was more or less the same as having a hole here and then just feeling absolutely crap, because it just used to knock the stuffing out of me. Having a whole one of these it just used to put me on my back. So like I say, luckily I've got a friend that gets me these. It sounds so dodgy, doesn't it? But they're actually diabetic. You can't get them from your doctors. You can go to chemists and ask for them. They think you're addicted to something, but you know, I just don't care. You can get hold of them. Okay, so this is going to go in here. You just gently squeeze it in. Okay, so that's full. You get the bubbles out of it. As usual, it's just, you just keep tapping it, get the bubbles all out. And you'll end up with that. Okay, so it goes 1 to 4 And that's usually what you get in there. Sometimes you get 5, but for me that's my hit. So out of this I get 4 injections just out of 1 EpiPen. 2 EpiPens, 8 injections over a 24-hour period, and that's how I've been coping. As soon as they occur, especially when they're chronic, I just take a shot. I've got my own little case. I preload these. I do it sort of every other day, so you know I preload my pens, and this has been my survival. If you're not getting these, I mean, many years ago I was getting these, and these were so easy to use. And I found out on Ouch how to split these, and they were just so easy. So you take the pen out, and some of you may well be getting these. I went to pick up a prescription and they gave me these after 3 years of getting those pens, so I'm not quite sure. But anyway, stick that in there, twist it, pull it out, and that's ready to go. That's what you would inject. But instead of that, twist the end, pull it out, and there you go. How easy was that? I wish I got these every time, but I don't. So that's how I split my jabs. And like I say, I would administer this in my upper thigh. I hate injections, but because of the pain, we all know what the pain's about. Nothing compares. So I know just a little prick, so to speak, it's going to make me feel a lot more better than if I didn't. Okay, I hope this helps. Email me or message me with any other questions. I might be able to answer them or help you a little bit. Just remember, you are not alone. I've been suffering this for as long as I can imagine. It's crippling. It sucks, but there are people out there that care and understand. I've never actually spoken about it before. I just go through it on my own. But it's wonderful to hear from and listen to other people's stories and to see how they're coping. Just another thing that I found out is supposed to be really good. Verapamil, I've tried it unsuccessfully for me. It might help other people. When you go to the doctors, do not leave that doctor until they prescribed you the injections for these. You must have the injections and the oxygen. Get an appointment straight away at a neurologist. I know that takes forever, but once diagnosed, they can't refuse to give you these injections. When I pick up a repeat prescription, I get 10 of these. Sometimes I get 12. You know, I'm not paying £7.80 a throw, whatever it is, for just 2 of these. I'm going in, I'm picking up a bag of 10, and I'm surviving. Peace out, people. Love you lots.